Hello everyone, I am Dr. Surya Prakash Edda, consultant neonatologist and pediatrician, Renova Hospital, Sanat Nagar. So many parents do come across a cough. So what are the remedies for a cough? What are the types of cough? So we'll just briefly discuss about the cough. So cough is a reflex phenomena where it can be starting from the throat, what we call it as medically pharynx. It can be extended up to the lungs, that to the parenchyma. So it is a reflex phenomena where the child tend to have a cough. Cough generally starts from around 6 months of age. So sometimes the parents do complain that my child is coughing at around 2 months of age. But generally it is a reflex phenomena where the child tend to cough because of something there in the pharynx or to the lungs. So briefly we'll discuss about what are the types of cough. So there can be wet cough and there can be dry cough. So today's topic we discuss about what are the causes of a dry cough. So dry cough is nothing but where there is no phlegm. So what the parents do tell about, we can hear the sound from the chest. So that is not a dry cough. Dry cough is a hacking one. Suddenly the child chokes or a cough. So that is something called as a dry cough. So depending on the age group, we divide the causes of the dry cough. So in a newborn period, suppose generally child doesn't cough. If the child is coughing at a newborn period, that is something is a serious which has to be addressed by the medical professions. So after 1 month of age till 6 months to 1 year, the child tend to cough. So what are the causes? So most important cause during that period is, we call it as gastroesophageal reflux. So what happens is, whenever there is a reflux from the gastric to the esophagus, the child tend to cough. Why is that phenomena? Because whatever the nerve supply to the airway and to the gastric are the same. So that is where whenever there is a reflux, the child tend to cough because of the same reason. So once you subside a gastroesophageal reflux, automatically the cough gets subsided. So that is most commonly what we see in a day-to-day practice up to 6 months of age. So after that, what are the most common things? So next most common is infection. So infection can be either viral or a bacterial, or for that matter protozoal. Protozoal is less likely to cause a cough, but most common what we see day-to-day practice is a viral infection. So what we call it as normal flu. Flu is nothing but they tend to have a cold cough. It can be dry to begin with, or later it can be a wet cough. So next most common important factor where they can have a dry cough is allergens. So allergens can be in the environment or it can be in the form of food. So in the environment, what we see day to day is smoking. It is a passive smoking or air pollutants. Nowadays you are seeing a lot of air getting polluted. We discuss so much about in the day-to-day practices that air is getting polluted. Whatever the carbon monoxide, dioxide are more in a content in the air and all those things. So those are the irritative cough where the child tend to have a cough because of the reflux. The next most important is allergens. In that we can have something called as, in older children we call it as asthma. So asthma, there has to be some trigger factor. It can be genetic or it can be allergen induced. So allergen induced can be either pollen grains or a hay or a dust or cockroaches, whatever it could be. Sometimes it can be related to food also. So in a food, most important is cow's milk. So if the child is taking a cow's milk less than 1 year, the child tend to have a cough which could be dry to begin with. So for the same reason, we tend parents to avoid a cow's milk till 1 year of age. So next, coming to the age group, older age group, the dry cough, it can be because of as we already discussed, like allergens, irritants, asthma, or sometimes in a 1 to 2 year age group, we see something called as foreign body ingestion. So suddenly the baby chokes and starts coughing. It is only a dry cough which is to begin with. Unless it gets infected, it causes a wet cough. So what are the remedies where parents should be aware? Like what are the ways where we can prevent a cough? So most important is, as we said, we'll go from the newborn period. Like newborn, we said that there is no cough reflexes. If it is there, it has to be dealt very seriously by the medical profession. So next comes the gastroesophageal reflux. So what do we do for a gastroesophageal reflux? We reassure them that it is a normal thing for the babies tend to have a reflux. Because of that, the child tend to cough. So we tell something called as GER position. So gastroesophageal reflux position, that is 15-degree inclined from the bed, and it can be right or left. Still it is debatable what is the exact mechanism where to prevent a GER. So suppose if the child has severe reflux, so what we tend to have is thicken the feeds. So don't, when the child starts weaning from 6 months onwards, we tend to thicken the feeds. Whatever feeds you are giving, you tell them to give a thickened feeds. It can, if the liquid is more, then the cough reflux, GER is more, the reflux is more. The next most important is air. I mean, air pollution is there, so child can't prevent it. Only thing is surrounding has to be clean and without smoke and all those things. The next is foreign body, as we discussed. Try to avoid foreign bodies, little, whatever the circular one, like what we call it as steel or something like that. So try to put it very far away from the children reaching that point, so that we can avoid aspiration for that foreign body. And next most important is flu, like as we discussed, like infection. So if the child at home, anybody is suffering from the flu, or adult, or for that matter even the elder kids, try avoid the younger one from them separated apart. So during this season, what we're seeing is COVID-19. That can also cause a dry cough. But as we already discussed many a times, that social distancing, mask and sanitization, that will improve the outcome of the infection will be reduced. Thus, the cough intensity will be reduced. So this is a very broad spectrum where we can avoid a cough in a children. So we'll discuss further about what are the remedies for a wet cough and all in a subsequent series. Thank you, one and all.